Everything we do starts with the community, starts with people, and we think about how the work that we do impacts people's lives.
The center is an operational arm that is complementary to the work that the foundation does.
The center has invited us actually into their home to strategize, dream, and envision a different future.
I would describe the center's work as really pivotal.
If we don't come back for each other, no one else is going to.
We do important things, a lot and together.
The partnership between the Center, Building Healthy Communities, and Black Child Legacy has really allowed us to serve families in a way that we've never been able to serve before.
Celebrating the center's last 10 years, we've just seen exponential growth in terms of the resources they've brought, the incubation of different organizations, and the ability to facilitate conversations amongst communities and groups that had traditionally not spoken.
It's important as we are creating policy for the state that we create those opportunities for our vulnerable communities to participate.
It's health equity, racial justice, advancing it in a huge region in California that represents the importance of California for all.
There's so many folks and organizations and institutions that need to collaborate and work towards this goal so that there is health equity for the people of the state of California and even beyond that. I think that that is really one of the most unique aspects of the center.
What has enabled us to be successful in the work that we've done is that we work with every community.
The Sierra Health Foundation launched a center to be a complement to the work that it was actually engaged in. It's designed not to simply expand our work or role or presence, but really to fill a need that we thought was critically important to producing the kind of positive outcomes the foundation was actually seeking. It was really an attempt to accelerate the idea that you could provide supports and services that would improve the life and life chances of folks in some of the most under-resourced communities across the state of California. Over the 10 years that the foundation and the center have been working together, we've been privileged to achieve some incredibly powerful outcomes. But I would say that none of that is as important about who we are as much as it is the importance of working collectively with the community.
Community leadership is essential to the work at the Center of Sierra Health Foundation. We truly believe that community members and leaders knows best how their community can reach health equity. They're well-versed in terms of the issues and challenges their community face, and they know what the community needs. And so who better to help us design transformative changes in communities than community leaders?
The Center and Young Women's Freedom Center has collaborated for years now, and so they've had deep investment in our leadership pipeline. I do know what it felt like to be invited in younger in my leadership at the very beginning, and I just remember having space to be able to be seen as a leader and an expert.
Us being youth-led is just hearing it from the source. It's not adults speaking for us of what we're going through. It's us saying what we want, what we need in our demands and things like that.
We support folks that have navigated poverty and violence, and they deserve opportunities to be able to thrive, live, and succeed.
I kind of just love the vibe here. I love the energy, the people. It's really nice to give back to my community, and especially to give back to young girls to show them that there are people who actually care about you and people who want to see you succeed.
Just even having a safe place for people to come and find community rather than be ostracized and pushed into the corners of, our city, our society, that's healthy. Finding community.
When communities get to be part of the stories and part of the narratives that they wish to tell, and ultimately to drive the destiny that they wish to fulfill, what you have is an opportunity for the grassroots to really dream and imagine something that is theirs, where they feel ownership of it, where they feel part of it, and where they feel bound to it.
One thing that I'm extremely proud of is I'm an SF native, and I'm somebody that grew up inside of San Francisco. And my family has been historically impacted by poverty and incarceration for the past 3 generations. And one thing that was very powerful that working with and collaborating with the center is them being able to trust us to be able to develop a real plan to drive alternatives to incarceration, and ultimately the Board of Supervisors unanimously making a decision to close juvenile hall.
We are unapologetic and unafraid to take on issues related to racial equity and health equity. We are focused on some of the communities that we know disproportionately suffer poor health outcomes. We believe building their capacity to engage with the public sector, to receive resources, to plan and design interventions is part of that secret sauce that allows the center to be successful.
Centering racial equity is at the heart of what we do, and oftentimes what the partners that we work with, what they do. Because by centering racial equity, what we're doing is making sure that disinvested communities are actually seeing a better future. We're seeing differences in infrastructure, and most importantly, just the resources to dream even of a better life.
The state of California is so incredibly diverse. And when you come together, you leverage resources in a way that you can meet the needs of that diversity.
In order for us to be able to make sustainable changes and to be able to tackle the inequities that so many of our communities find themselves in, we have got to be able to put in place good policy. And in order for good policy to take place, then we've got to be able to organize at the community level.
Building Healthy Communities, we are a collaboration of about 30 organizations, all working together to create systems change, policy change, and a lot of the issues that we consider barriers for some of our most vulnerable communities to be able to access services and supports. So we work on everything from food access or lack of food access, healthcare access. Racial equity is kind of the foundation of our work. We work in education. So it's a plethora of things that we work on, really trying to help support our folks who live in communities that are often ignored.
With the center, with the funding that it has and with the great staff that it has as well and the leadership that's here, it can make connections with those that are policymakers. They can see that there's a different way of making sure that they have access to this healthcare or access to other things that affect their environment.
The work we've been able to partner with them on has been beneficial, has been meaningful, and has impacted communities in ways that, we couldn't even imagine. It's allowed us to build up our capacity so that we can serve families more effectively. And I think that has been one of the biggest opportunities that this partnership has brought to us. Yes, there's the financial part, and that's huge, but it's also trainings that we are able to participate in together. It's retreats that we're able to do together. It's building, having shared goals and shared understanding of how we're going to accomplish this work. It's bringing multiple partners together into one space to have these conversations about how we can support Black families. It's just this great synergy that allows for us to continue doing the work that's going to change lives.
I spent 10 years working in the emergency department in Selma. It's the raising capital of the world, where I saw 50,000 patients myself. In that capacity, I saw many of our vulnerable communities who struggle to have access to healthcare. And that injustice helped to shape me running for office. Porque yo no puedo ver a mi gente solo. I cannot see my people alone. A great example of the center is the San Joaquin Valley Health Fund, a fund that helps to create capacity within our nonprofits, our community-based organizations, to help us to advocate for health and racial equity, for health and racial justice, for environmental justice, and a policy that's needed for our communities.
When folks don't have what they need, there's a reason why. There's a breakdown in our system. And we can't fix our system if we don't understand that. In order to understand why the system is broken, we need to hear from the people who are experiencing that.
I like to remind people we're here at the people's house doing the people's work. And to do that, that requires the people actually coming to our state capitol. Equity on the Mall is a great example of how we are able to bring people here so that they can have their voice heard, so we can stand up on issues that matter to us. Whether or not that's access to clean air or clean water, or to address some of the historical wrongs that have happened to our communities, Equity on the Mall is that opportunity for people to come here to their house and to make sure that they're heard.
The Chicago movement was born actually in Fresno, California, and over the last 20 years, we've really grown to work throughout the greater state, from Bakersfield up to Stockton, from Yuba City to Union City, especially with the Punjabi Sikh communities, but oftentimes partnering with organizations throughout the regions we work. It's really been this partnership with the center and the San Joaquin Valley Health Fund that has allowed us to work with other groups, build with other groups, learn from other groups, and expand our own work. One that we have seen have the largest impacts was actually working with the center around the 2020 census. We reached over 150,000 Californians, whether that be in language, especially in Punjabi and Spanish. From that, we were able to work in redistricting across the state, but probably most importantly, in municipalities, at the counties, and even at the school board level. But more important than even individual successes, it's really been about being able to reallocate resources to underscore those communities that have traditionally felt marginalized or been most left out, where they have a voice, and to make sure that we're seeing improvements around health, around housing, just the resource allocations into communities that have been traditionally left out.
At the Center Sierra Health Foundation, we don't shy away from being innovative in our response to communities' needs.
How I explain health and well-being is really mind, body, spirit. Housing, community, culturally affirming care, and just being able to, be able to have a job. We're meeting some of the basic immediate needs of folks, so then they can actually really stand in their power and agency and be able to inform what change looks like.
Northern Valley Harm Reduction Coalition is a physician-led harm reduction coalition, and we provide safe supplies for folks involved in risky behavior. Harm reduction buys time for the bigger picture, right? Like, we just want to keep people alive until they can do something different. That's all we want to do. Our collaboration with the center has helped us deepen and improve relationships with the community by giving us resources to be able to get out there and make connections. Some of us are able to be here a couple hours a week. We have a lot of volunteers. But mostly it just gives resources that we can use to engage with folks that can't make it here.
As we emerge from the pandemic is still amongst us, but as we move from relief to recovery to resilience, we're really focusing on inclusive economic development. We're focusing on climate justice. And then, of course, to ensure that our youth have access to every opportunity so that they can be as healthy as possible. You see that in the work that we're currently involved with our San Joaquin Valley Health Fund. You can see that by way of our work with the Black Child Legacy Campaign.
The Black Child Legacy Campaign is really one of the principal, I think, achievements that we share, both the center and Sacramento County. Looking back, it's one of my proudest moments as a member of this board.
What is unique about Black Child Legacy is that we get to unapologetically support Black families. I get to stand up and say, this is what I'm doing for Black families. Because right now in Sacramento County, Black children are dying at a higher rate than other children in this county, and we've got to do something to keep our babies alive. We get to do that on a daily basis, and we get to bring hope and we get to bring help to those who need it most.
I think the way we measure our success is really in saved lives, and of course, the ongoing success of those individuals.
The state of California, the future of our state, the health of our state requires not just funders working together, but all of us working together to broaden our understanding of what community needs are, leverage the strengths of other organizations as well as ourselves around the engagement of community, not just getting their input on what they need, but really building the leadership to build capacity in community for the long run. There's a saying, no one person knows everything, but together we know a lot. And I think it's the same when you think about doing. No one person or organization can do everything, but together we can do a lot.
Our success is their success, is our community's success.
And what the center offers is a framework and an infrastructure for ready-made partnerships. It's public sector, it's private sector, it's philanthropy, it's grassroots organizations and nonprofit providers. All of that is sort of housed under one roof. Health equity is about optimizing the conditions under which everyone has the opportunity to be healthy. What is health? Health is wellness, joy, spiritual, emotional, and mental well-being.
Health is the goal of an equitable society.
Health is a state of physical, mental, and social well-being.
Health is abundance.
Health is equal opportunity to succeed.
Health is power to the people.
Health is freedom.
Health is for everyone.
Health is living free with love.
Health is a human right, and if I can add, the health of each of us is dependent on the health of all of us.
At the end of the day, health is everything.